everyone. Welcome to Let Care Speak. I'm your host, Danyata Small, and today I am talking with Dr. Kelsey Asplin, referred to many as Dr. K. And she is a naturopathic doctor and founder slash manager of the Denver Naturopathic Clinic in Colorado. Dr. K has been in private practice for over 10 years, and she specializes in functional medicine. And what really sets her apart is her commitment to patient centered care and her belief that the connection between body, mind, and spirit is essential to wellness. Now, she's deeply passionate about the naturopathic profession and led the board of the Colorado Association of Naturopathic Doctors. And she's also an advocate for professional integrity and the importance of rigorous training and standards in naturopathic medicine. Dr. K, welcome to Let Care Speak.
Thank you so much for having me. It's such a pleasure to be here.
Thank you again for being here. So, yeah, let's just jump right in.
All right, let's do it.
So, you grew up in Lakewood, Colorado, and you studied integrative therapeutic practices at MSU Denver. And MSU stands for Metropolitan State University of Denver, before going to Bastyr University, which is in Washington, for your naturopathic doctorate. I find that quite interesting. So, could you tell us what drew you to naturopathic medicine in the first place? And was there a specific moment when you knew that this was what you wanted to do?
So this is like the age-old question that all naturopathic doctors get asked because everybody's like, "What a weird choice of an occupation."
Right.
Happens. So and I would say there's certainly a thematic element to most naturopathic doctors in terms of their path into this field. And I'll come to that here in a minute. But when I was growing up, I never knew naturopathic medicine existed. My dad was an RN, and so I grew up in a conventional medical family. Didn't go to the doctor very often. It was kind of like you only went to the doctor if you were bleeding out, like it's like very and otherwise like you just took care of things at home. So the idea was like, the doctor was for emergencies only that couldn't be handled at home. And I grew up thinking that. I actually had no desire to ever work in the healthcare field. It was never on my mind. I actually started my path. I grew up riding horses, and I started my path thinking I was going to have a career in the equine field. I started my undergrad that way, and it really kind of changed. My path changed probably more so like my, halfway through my first year of college, but I think I was actually on the path before that without really knowing it. So when I was in high school, my junior year-ish of high school, well, it was probably earlier than that, but I got really bad eczema, which many people have. I'm sure many people who listen to this are familiar with eczema. It's, an uncomfortable skin condition that can create itchy, red, inflamed plaques. And for me, mine were showing up on the back of my hands, but also on my face. So I had these like big patches on my face. And, nobody wants that. But as a high school girl, that was also just like, terrible. And my parents took me to dermatologists, which is kind of the typical route that you would initially start. And I just, I got the typical treatment. So it was basically like, topical steroids, topical creams, all the topical things, most of them were steroid related. And I didn't know any better. So I was like, sure, I'll try these. So I did that, and nothing touched it. It didn't help. So like nothing ever got better. I don't know if I would say it got worse, but it definitely didn't get better. And so I eventually kind of like, gave up on that. But I was just so frustrated because if you've ever had eczema, it's so uncomfortable. Like it's just itchy and flaky and weepy. And I ended up just like out of sheer desperation walking into a natural food store and found a product on their shelf that was labeled like for eczema. And I was like, why not? I'm going to try this because nothing else is working. Right. And so I bought it and I opened this tube and like I squeeze it, and we're so used to things being colored or flavored or scented or whatever, and like this was none of that stuff. This thing was nasty looking. It was like brownish green goop, that like it smelled weird. It didn't look great. I was like, oh God, what did I get? What have I done? But I didn't figure I had anything to lose. So I went ahead and I used it. And I can honestly say that within a week, things started clearing up, which is like, none of the medications I had ever used were doing that after weeks and weeks and weeks of applications. And so there was kind of a part of me that was like, there's something to this. But I was in high school and I was getting ready for college. I just wasn't thinking really anymore about it. And so that went away and it became something that was pretty manageable. And then, fast forward to my junior year in high school, and I was on a trip doing a college interview at one of the places I was looking at. And in the middle of my interview with the dean of the school, I got my first migraine. And it was like I was there, but I wasn't there.
Yeah.
And afterwards, my mom was like, what is wrong with you? Like, you totally like checked out. Probably was just a terrible interview, but I couldn't break it. Like I couldn't get out of this fog and I felt nauseous and we kind of figured it might have been a migraine. We tried some Excedrin and it helped. And so that actually kickstarted for months, a long, long time of like daily migraines that I would get these chronic migraines. And so then once again, my parents took me to go see a doctor, and I think I was seeing a neurologist, and they kind of did a very, I'm sure, standard workup. I would consider pretty basic at this point. Didn't ask a ton of questions. I think they were more so just trying to decide that it wasn't a tumor, and ended up putting me on medications. And the meds that they put me on were antidepressants. Antidepressants are often used as an off label for migraines. Like I knew about antidepressants because unfortunately every high school student knows about antidepressants because so many are put on them. And so I started taking this medication and, without any other explanation, I would say within a certain time period after taking it, I started exhibiting signs of depression. Like I just would get kind of sad for no reason and feel like crying. And I had never been that person. And I was like, well, I know that antidepressants can make you more depressed. Initially, I knew that. And so we went back to the neurologist and I told her that I was concerned that the medications were making me depressed. And her response was, oh, no, that's not possible. It's too low of a dose. And I was just totally written off. Like there was just no conversation about it whatsoever. But I knew, and like, so I stopped taking the med, I was just like, it's not solving the problem. And, a couple years go by, I started my college education doing equine therapy and, kind of got rerouted early on and was trying to figure out what I wanted to do. And, while I was in school doing my general, studies, I was taking a yoga class elective. And I remember this is so funny because now everybody does yoga, but at the time yoga wasn't like, it hadn't caught on the way that it is now, and I was in the class with another woman. And we were just talking about these experiences. And I was like, it's so strange to me looking back that nobody at that time asked me like, what's your stress level? Or, what kind of pillow are you sleeping on? Or, what are you eat? Like there was really no investigative, like aspect at all. It was just, oh, well, here's our standard of care. Let's put you on an antidepressant. And it just got me thinking about that and this experience with the eczema. And I was like, God, there's just got to be more to healthcare. There's got to be a better way. Because I know I'm not the only person, who's felt this way. And she actually, that girl, told me about a program, a minor at the college I was going to at the time in holistic health. And I was like, oh, I don't even know what the word holistic means at this, like, because again, it hadn't caught on as a buzzword yet. And I was like, oh, that's so interesting. So I started looking into the minor and into the major, and saw that there were all these like really cool classes that were totally foreign to me at the time, but they were like, traditional Chinese medicine and Ayurvedic medicine and herbal medicine and, complementary and alternative therapies, like all these just cool classes that when I was reading the descriptions, I was like, yeah, and like anatomy. And so I signed up for just a couple classes just to kind of see what it was all about. And my first day, my teacher walked in and he was a naturopathic doctor. And he introduced himself as such and kind of explained what that was and what the philosophy of naturopathic medicine was. And I was just like, I was like, what is this? It's like, here you are, and I just, the first class I took was kind of a general holistic health class. Like, what is holistic health? And looking at it in different ways and all of the different viewpoints. And I was just so enamored by it, and by the fact that most other healthcare systems outside of the conventional one focus more on lifestyle and wellness and, mind, body, spirit and the pillars of health. And like, it's just so different than what most of us were raised with. And I was like, oh my God, well, this is the medicine that I've been looking for, and that teacher ended up becoming one of my mentors. And my junior year into that college program, he approached me and was like, what are your plans for when you graduate? And I was like, I don't know. What am I going to do with this integrative health degree? And he was like, I think you should consider medical school. He was like, I wouldn't say that to everybody, but I think you should. And initially I was like, that's a lot more school. And I wasn't sure I was in love with that. But I thought about it more, and he actually had this really lovely perspective that he shared with me. And he was like, you can look at it as another 4 or 5 years of school, or you can look at it as this time in your life that you get the opportunity to learn so deeply about something that you love from the greatest people who can teach it to you. And that just totally shifted my perspective. And I was like, wow, you're so right. And like, what else am I going to do? And like, what am I going to do with this degree, as an undergrad degree? And so I decided to go to naturopathic medical school. And that is ultimately my path. And now I've been doing this for 10 years and I love it. There's a lot about it that's very difficult. And there's, days that are harder than others, but there's also days that are so rewarding. And it's such a unique and wonderful and timeless form of medicine. And it really is such an honor to get to have learned the things that I now know and get to see those in action.
Wow, and it's actually really apparent that you love what you do because as you're sharing your story, light up. And I was like, oh wow, I can see it. So yeah, thank you. Thank you so much for sharing that with us. Wow, you hear that, viewers? Look at that. These series of unfortunate events led to this journey and path of naturopathic medicine. How
Well,
cool
and
is
that's that common theme in a lot of our providers is they are people who could not find answers in the conventional healthcare system and had to look elsewhere and ended up finding answers that way. So I do think that's something that makes our doctors, I'm sure that I know that there are conventional doctors who have a similar story, but I think because it's such a kind of ingrained part of so many naturopathic doctors that we are the people who slipped through the cracks, or we were the people who didn't fit the algorithm, that we have a different level of compassion for those patients, because those are the patients we tend to see often.
Yes, and I lovingly call you all the doctors who think outside the box because yeah, just speaking from my own personal experience. And conventional medicine, great. It saved my life and things of that nature. But Yeah, I like to consider you all a bit more creative thinkers. And I
Yeah.
appreciate I do. And so, Dr. K, after 10 years in private practice, you're just what I was just talking about, you're still passionate about this work. And so, I briefly mentioned that you led the Colorado Association of Naturopathic blah, blah, blah. In that time, let me just start over. Okay. So yes, Dr. K, after 10 years in private practice, you're still passionate about this work because it's so evident here. And in that time, you've led the Colorado Association of Naturopathic Doctors. You taught at MSU Denver, and you've made some big changes with your clinics. So, why is this work so important to you, and what keeps you going?
So as I said a minute ago, like that, this is hard medicine. It really is. And I appreciate this question because I've never been asked that question before. Like what keeps you going? Um, naturopathic medicine for so long has been fighting an uphill battle for recognition, for acceptance, for equality, for so many things, and it continues now. I mean, our scope varies state by state. Our even though like we're trained at a nationally accredited naturopathic medical school, that we have to sit for board exams and we have to get licensed in state, like it's very rigorous, and there's still this just massive lack of recognition and respect for our field. And, I think early on that was a lot harder for me to bear because I was just like, like fight the fight all the time. And now, like, it's, I think that's why I was part of the association for so long, is I was very passionate about trying to um, get more people to one, know that we exist, and really what our training is and what we're qualified to do, and just how great this medicine is. um but it is tough. It's an uphill battle. It's like anytime I want to talk to my patients, conventional providers, they never want to talk to me, or they'll just flat out tell me that like they don't believe in what I do and they don't believe in what I'm recommending, so they're not going to order certain labs for my patient, which just hurts the patient, right? So and there are days, I think, too, yeah, there are more than a few days that at the end of the day I think back to high school when I worked at Starbucks and I think, man, that's a pretty good gig. Like, you work a set number of hours and your day ends when you clock out and you don't have to think about making coffee anymore, and the worst thing that can happen is somebody's beverage gets screwed up.
Yeah.
I miss those days sometimes. It's a it's there's a real depth to holding somebody's health. And I will say that naturopathic medicine does not do emergency care. We don't do, we don't do things that are going to we don't manage cases that are better suited for the emergency room or the hospital. And like, we're really good at chronic care. We're really good at preventative medicine. Um but like there's still a weight to holding somebody's health and trying to walk the path with them. And naturopathic medicine is not fast medicine. It's not take a pill and call me in the morning. It's change your diet and change your stress and change your sleep and take these supplements and let's see how you feel in 3 months. Like it takes some time because we are totally our philosophy is totally different, and so our approach is totally different, and it's more about strengthening the foundations of health at a cellular level first, and that can take some time, especially if somebody has been out of balance for decades. And so there's a lot of times where patients get frustrated because they're not getting the results they want, and maybe that's because it's not happening fast enough, or maybe it's because they're not as committed to the plan as we need them to be. So there are tough days. There are also really great days, where I talk to somebody and they tell me, man, I've only ever been written off before. And it's so different to be here and to be heard and to feel like you understand, and I love that you explain everything, and then, some time goes by and they get better. you know? And those are the days that I'm like, man, this medicine rocks. I'm like, those are good days. And those days definitely help keep you going. But I think regardless of the good days or the tough days, I think one of the common or the essence of really what keeps me going is that I believe so strongly in autonomy, and that that's a basic right that we all should have, and part of that is your choice of healthcare. And I think that it's so important that people have the opportunity to seek out and to have access to all different forms of healthcare, not just conventional care. And I am not an anti-conventional care person. I'd like you, it has saved my life. I think that it has saved many of my patients' lives. But there's so many different forms of healthcare in the world that have been around for so long, and they all work at different times for different people. And I genuinely believe that we can all play in the same sandbox, and we all have something to offer somebody. And so I think that is a huge part of it, is continuing to be a part of an opportunity for people, or a choice for people, to be heard and to have their experience validated, because that's often not happening, and to have the time for somebody to not only listen, but to actually explain things to them so that they feel empowered. Like they feel that they understand what's happening, and they feel empowered about the options in front of them and the choices that they make. And I think that's a huge part, I think, of what keeps me at it.
Yeah. And, just speaking from patient experience, I would say that is definitely missing in conventional medicine. Just having that that patient client connection where there is open communication and explanations, and the patient is heard, and just exactly what you're saying, where the patient feels validated. Because at the end of the day, I mean, that's all we want. We just want to be heard, and yeah, and validated. Like, okay, I'm not going crazy here. So yeah, thank you for touching on those things. I really appreciate that. And so while we're on the topic of naturopathic medicine, a lot of folks out here don't really understand what naturopathic medicine is. They hear that and they're just like, who is that? So, they may think it's just, some herbs, or, because it's not conventional medicine, they may be skeptical about whether it works. And so you touched on it a little bit, but yeah, let's just go more into the explanation of what naturopathic medicine is and how it's slightly different from conventional medicine.
Yeah. I love this topic. So reel me in if you need to at some point. I mean, this again, part of why I was on the board for so long is this is a passion for me. So I'm going to get a little technical at first. Um, so there is the language around what naturopathic doctors do is actually very important. And unfortunately, it's not something that is like mass distributed or understood by the public. So there is a very clear difference between a naturopath, a traditional naturopath, and a naturopathic doctor, and a homeopath. And those are often used interchangeably. Or a lot of people will call me a neuropath, which is more brain related. so,
Mhm.
so it's not that. And so I want to explain the differences between those, and then I'll talk about our education and our philosophy and things like that, because I think that that's huge into what the difference is here. So, the first thing, so a naturopath, if it is not followed with the ick doctor or the IC doctor, naturopath, can be anyone. So that does not mean that this is a bad provider. I'm not saying that at all, but pretty much anybody can call themselves a naturopath. And so, naturopathic medicine is not something that, if you look into the history of our schooling, there was like this time that there was a lot of schools that taught naturopathic medicine and homeopathic medicine. And then there was this major downfall, which, was prompted by the American Medical Association and a bunch of different things. And then, it's like kind of come back a little bit. But there was a time that there really wasn't access to a higher level education in naturopathic medicine. And so, a lot of people learned it in different ways. Like either it was passed down through, medicine women and midwives and herbalists and things like that. And like those were the original naturopaths, like for sure, and they've helped so many people. And today, those people are still around, but a lot of people who call themselves naturopaths have not really received even that kind of like passed down apprenticeship type training. A lot of times it's people who certainly have an interest in natural wellness or functional medicine and, or lifestyle medicine. Maybe they have a certificate in lifestyle medicine or health coaching, and have maybe taken some courses or certifications in natural medicine, whatever that might be, right? That might be herbal medicine, that might be whatever. Some of these people have also technically attended like a distance learning higher education program, but those are not considered doctoral programs. There are certain requirements in order to be actually considered a doctor. Even though those schools will tell them that they're getting a naturopathic doctor degree, this is a big problem for public safety. Those programs are all like online coursework based. They don't have any kind of clinical education based. They don't have any kind of board exams. They don't have anything like that. And so there are a lot of people who, are well intentioned and want to be able to help people, and in some way probably can in a I would argue probably a more limited sphere, just because of their training. But they are not a doctor. And in order to be a doctor, you have to attend an accredited doctoral level education. You have to sit for board exams. You have to have a license. And to be a doctor means that you are legally allowed to diagnose and treat somebody. And a naturopath cannot do that. And so there is a very important distinction there, because it just depends on, and again, I'm not saying one is bad or not. It just depends on what the patient is wanting to get out of it. So if you are looking for somebody who can order labs for you and interpret labs and order imaging and interpret imaging and, really diagnose and treat you from a naturopathic perspective, that's probably not a naturopath. That's a naturopathic doctor. If you're looking for somebody who can be more of like, an ally or a coach, or explain things, or maybe do some of the kind of therapies we do on the side, like that might be okay. But I do think it's really important that people know that, so that they can advocate for themselves and find who they really are looking for. Unfortunately, the reason that we're passionate about this is, unfortunately, there have been people who have gone to these kind of mail order degree schools and then hold themselves out to be a naturopathic doctor. Anybody can, create a diploma and print it off and hang it on the wall. And they've done that and they've hurt people. And that looks bad for my industry. And it's not good for the patients. So, if you want to see a naturopathic doctor, there's only 6 schools that accredit it in the United States and Canada. So, you can just look on their website and see where they went, or you can like find this out. A homeopath is somebody who practices a specific therapy called homeopathy. Homeopathy is one therapy that naturopathic doctors learn, but that's alongside all the other therapies like herbal medicine and, physical medicine and all the other modalities. So I hope that makes sense. I know that's a little bit of a soapbox, but I do think we are at a time that patients have to self-advocate. because there's nobody screaming from the billboards like naturopath versus naturopathic doctor or supplement versus, like, nobody's doing that. Nobody says like Amazon supplement, is it the same as your doctor's supplement? Like, nobody's talking about this, right? And the answer is no, they're not the same. And unfortunately, there's no reason that people would even think to look that up. So I hope that that's helpful. As far as our education goes, so naturopathic doctors, the education actually looks very similar to conventional medical school for a significant portion of it. And this is where it drives me crazy that when those conventional doctors who are disrespectful to us, I'm like, you are smart people. All you got to do is look up what we learn, like, just go do some research. But if you actually look into it, our education starts very similarly. We learn all of the same basic sciences. That's like your anatomy, physiology, histology, pathology, all of that stuff. We learn all of the same specialty therapies. So we call those the ologies. That's like your gynecology or oncology or cardiology, like all of the systems based specialties. So we learn like what's normal, what's the physiology. We also learn the pathology, which is the disease. Like, so we learn the normal healthy state. We learn the disease states. We learn, how it functions, why it functions, the biochemistry behind it. So that's all actually very, very similar to conventional medical school. We do learn pharmacology. I would say that our pharmacology probably is not as extensive as conventional medical school, but that's because it's not our primary thing that we're going to use, But it is important for us to know because so many of our patients come to us on pharmaceuticals and we need to understand what those do. We're not just going to like have our head in the sand and pretend they're not taking, 8 or 9 different pharmaceuticals and do our stuff and just hope nothing happens. That's not going to happen. So we need to know what those medications are, how they interact with each other, how they interact with the natural modalities that we might be offering. And so we learn like the top 200 mostly, those are part of our board exams. And we learn about the classes. So as most people know, there's a lot of medications that sound the same in their name. They kind of do the same thing. They're like, Me Too's, the previous ones. So we learn about those classes. So as new drugs come out, it's not like we understand how they work. And so I would say in that regard, it's very similar. Where we branch off is we do a significantly higher level and way more hours of nutrition and lifestyle medicine. We do learn various forms of counseling because we know that is helpful to a therapeutic relationship, and our appointments are so much longer that it's nice to have that. And then we learn all of the naturopathic modalities. So that's going to be things like herbal medicine and homeopathy and physical medicine. Our schooling does include spinal and bone manipulations, so we can do that in a lot of states. We learn, therapeutic ultrasound. We learn, just so many things. We learn hydrotherapy, so different forms of water therapy. So many things. And then we also have within our school clinical rounds. So every term we are part of various clinic shifts that may see the general population, may see specific populations like cancer patients or diabetes patients or HIV patients. And then we also have to go and do our own preceptorship or kind of like shadowing or internship. We have to do a certain number of hours of those within our schooling to graduate. And then, like I said, we have 2 different forms of board exams. We do one kind of halfway through our education and another at the end. Our first set of boards is 1 day, and then our second set is 3 days. So it's very intense. And then you have to apply for the state. There have actually been, periodically, every handful of years, there's a study that comes out that compares the education of some of the conventional medical schools with some of the naturopathic schools and some of these mail order schools that I mentioned. And it's always really interesting to me because consistently the school that I went to actually has more hours of education than Yale Medical School. And it's because we overlap in almost everything and then some. So, our training is incredibly rigorous. I think there's this thought that we're just like hanging out in the woods, picking up sticks and singing Kumbaya, like, and that's just not the case. You know, like we might go now and then, but like we there's a lot to it. And it is tough. It is tough. And so our training is very good. I truly think it is. And we've certainly had people come through the programs who've done conventional training and ours, and I think a lot of them would vouch for that. We've had people come into our anatomy, like our gross lab classes, and talk about how much harder our exams are than what they were used to in conventional schools. So it is very rigorous. And then I think, a huge part of what shapes our philosophy so differently than conventional medicine, and what really changes the way we approach patient care, is I think conventional medicine is very focused on pathology or disease. Like, what is the problem and how do we interrupt it, right? Which is incredibly important if if your arm is falling off, or you're bleeding out, or you're having a heart attack. Like, it's very important that we stop that very quickly. Naturopathic medicine is way more focused on physiology, which is like what's normal and how do we promote that in the body? How do we help the body get back to its normal functioning? How do we optimize that? And that's our entire purpose, is trying to, like, how do we help the body help itself? How do we get it back on track? And that really shapes the conversation that we have with people, and the remedies we use, and the options that we have.
Wow. Is all of that in 4 years?
Well, I would say, okay, that's a great question. So when I was in school, 4 years was the shortest time that you could do. I did it in 4. I would say the majority of people, like, when you start out, most of the people are like on the 4-year track, and probably by the beginning of the second year, about 80% have switched to the 5-year track. To slow it down, just because it's so intense, and some people do it in 6. Now it sounds like they're starting to offer it in 3. Which, I think they're doing that to be competitive with the medical school programs that are offering in 3. I don't know that that's a benefit to anybody, but it's what there is. So, it is funny because I did it in 4, and I remember the day I graduated, my whole family was in town, and I was standing. I just kind of walked away from the crowd and was standing and looking out at the water, and I was just like numb, like, and my mom was like, "Are you okay?" And I was like, "I feel like I just survived a 4-year trauma," and I remember being like, why was I in such a hurry to get it done in 4 years? Like, I just had this internal, like, I get it done in 4 years, like, that's just me. But I'm like, man, why was I in such a hurry? Like, there was no need to be. So yeah, I don't know about this 3-year thing.
Wow, I'm actually intrigued. And from the sounds of it, naturopathic medical school, for me, and just in my opinion, just seems more wholesome than the conventional medical school route. Yeah, for me, but that's, I guess, just because of my own personal experiences and so forth. Because yeah, it just seems more holistic, everything. But yeah, it would be kind of like a no brainer.
I think, like, what's so interesting is, like, I mean, I agree with you. Obviously, I'm biased too, right? But, like, I would imagine that most people who go to medical school are going to medical school because they do want to help people. And I think most people who want to be a doctor think that they're going to be doing a lot of what naturopathic doctors do, and they don't, because it's not in their education. I mean, I can't tell you how many medical doctors I've talked to who are just like so burnt out, and they're not practicing the way that they wanted to, and they don't feel like they get to spend enough time with patients. They feel like their hands are tied in terms of what labs they can run and what therapies they can provide, the only therapy they can often provide is pharmaceutical, because that's what they were taught and that's what they're basically told they have to do, or their paycheck is incentivized to do. And I don't think that the way that, most conventional providers practice is what they dreamed about doing. And I don't want to make a blanket statement and piss a bunch of people off, right? But that is my impression of talking to people, is I think people who go into healthcare go into it because they want to help people. And I think it's hard to help people if you only have 15 minutes to talk to them and you don't understand what makes them unique. It's like we can have 10 different people in a room with high blood pressure, and all of them are caused by a different problem. One person it's stress, one person it's food sensitivities, one person it's actually their blood sugar issues, one person, and yet in a conventional world, it's, oh, you have high blood pressure? Well, first we do, this medication, then we do this medication, it's an algorithm. It's totally based off of an algorithm. And if you don't fit the algorithm, then you don't fit that model of healthcare. Whereas in naturopathic medicine, like we so strongly understand the unique nature of every person, and that what is in the textbook may be most common, but does not encompass everybody. And so we often find people who get thrown off the algorithm because they don't fit the box. So I love that you call us the out-of-box doctors, because we are. we get all those people. So yeah, I mean, it is always interesting to me that there is such a, that people lock horns so much over naturopathic versus conventional medicine, when like if really what we're trying to do is help people, then why does it matter? If there's different options to do that, and if we have different tools in our toolbox to do that, like shouldn't we be all on this front together trying to help people?
I agree.
So, yeah.
I agree. Yeah, I won't get into the political aspect of that, but
We'll be here all day.
right. But yeah, I wholeheartedly agree with you there. Excuse me. Okay. Well, I built an app that helps patients turn their overwhelming medical information into understanding, and give them some confidence and take actionable steps. Because I see that the confusion about healthcare prevents people from taking care of themselves. And so, from your perspective as a naturopathic doctor, where do you see patients struggling most with understanding their health? And how important is patient education to your treatment approach?
I love that you made an app to
Thank,
help solve this problem,
thank you.
because it is a huge problem. And one of the things that I like pride myself on in my practice is trying to take the overwhelm out. I say I like take the BS out of the healthcare experience. uh, and so I love that you've done that. I know. I probably would answer that in like a couple ways. One, I think that there is kind of this generational shift in how people view their doctor. I think, decades ago, and still kind of happening with some of our probably more senior population, is it used to be that the doctor was like, the like matriarch or patriarch, or they were the dictator in the relationship, and you didn't get to know why or when or how. You just did what they told you to do. And I still think that there's some people who see doctors in that light. And I think there's probably still some doctors who practice in that way, whether they mean to, or maybe it's because they only have 10 minutes with somebody, or, I don't know. But I think there's this shift happening from that to, more patient advocacy or self-advocacy, and having their questions answered and thinking to ask the questions. And so I think there's some sense of overwhelm there, of like, well, what do I know? What do I not know? And what questions am I supposed to ask? And how do I advocate for myself? It's like everything I just said about naturopathic medicine. Like, nobody knows the difference between a naturopath and like, they don't know to ask the question, And I talk a lot about like supplement quality, and people don't know that there's a difference. So I think there's a lot of just overwhelm in the sense of like, we don't know what we don't know,
Mhm.
as people, as humans, as patients, um, even as providers. I mean, I think sometimes we know what we don't know, but but sometimes we don't. And I think there's also just such a sense of overwhelm as technology is advancing, um, which I'm sure you could talk to since your history is in IT as well. But I think as we have gained more access to knowledge through the internet, and now with I think that, on one hand, there's probably a great benefit to that where people can so much more easily find information just, a couple clicks away. But I also think that adds to this immense overwhelm because there's just so many different people with different opinions and different thoughts telling you to do, this fad or take this supplement or do this diet or, like, and then you start bringing AI into it, and AI really is just stealing from other people's websites, so it's still just a conglomeration of other people's opinions and research for sure. But unless you like really know how to talk to AI to generate results, it's all still kind of opinion backed and may not be truthful and may not be correct, but it is very convincing. And so I think, a lot of times people will actually come into my office, and I hear this a lot, and they'll be like, I listen to a lot of podcasts, or I follow a lot of like health speakers, and, I'm really invested in my health, but like they all say different things and I just don't know what's right for me,
Mhm.
or they'll even come in and be like, well, I looked up this on chat, but like, I don't know if I'm allowed to say that. I looked this up on AI.
Yeah.
But, but I also just wanted to talk to you about it. And I appreciate that. I think people, for a long time, we used to call it like Dr. Google, and now it's like Dr. AI, where it's like,
Yeah.
I just to my medical degree, and
Yeah.
like, in a way, like, you can find a lot of really good information on the internet. And like, I really do. But what the internet can't do is it can't take into account your individuality. It can't look at those 10 different people with high blood pressure and figure out what each person needs based on the causes and the contributing factors. It can't do that. Um, I don't think that technology is at a point where it can, feel your body and feel for problems within your body the same way that our hands can. There's just something different about seeing a practitioner, and I think that our job as a practitioner is to help wade through that overwhelm and say, recognize the truth that's there and recognize the variabilities that aren't taken into account, and take the person and say, okay, this is your history, these are your concerns, these are all your contributing factors, and based on all of that and based on my expertise, this is what we're going to do about it. And I think that is what's so important. So you asked about education. So education is like a huge part of what I do. It's a huge part of naturopathic medicine. It's one of the naturopathic medical principles, is that the doctor is also a teacher, and that it's such a different health outcome experience when the patient is empowered and when they understand their health in a way that's like really digestible, and that they can really wrap their heads around their options. They have true informed consent about whatever they choose to do, and they know why they're choosing it. They know what to expect, good or bad, and they have follow-up that can pivot if something doesn't go right. And I think that education is such a key to that. So that's why our appointments are so long. My initial appointment is an hour and a half with somebody. My follow-ups are typically an hour.
Ooh.
And I draw pictures, and really bad pictures, but like I draw pictures and I use lots of metaphors. And I think it just changes the experience so much, because a lot of people will go to anywhere. I mean, how often are we in a social situation and somebody like explains something and they're like, do you get it? And you're like, yeah, yeah, I do, and like, we don't want that to happen.
Love that. Yeah.
Yeah. So I think, that Yeah, that's what I would say. I think a lot of people have a massive amount of overwhelm because of the massive amount of opinions and health anxiety and stress in modern day American culture. And I think having somebody who can hold space for that and then help navigate on an individual level is hugely important to their outcomes.
Oh, you are preaching today. And yes, those are a lot of the things that I talk about as well. So listen, you all, I'm not that crazy. Look at that. I got a board certified doctor here just validating all the things. So take note. But you also you talk about the connection. Let's jump into the mind, the body, mind, and spirit connection here. Because you do talk about that connection and how it's, essential to wellness. And, yeah, that's the holistic approach, right? So could you explain what that means and how it shows up in your work with patients?
Yeah. I truly don't understand how anybody could not accept that is the connection anymore. Like I'm just flabbergasted, honestly. Like how is that not common acceptance at this point? It just blows my mind. But okay, so examples, I guess I could say. One of the most interesting patterns I have seen in my practice over the last 10 years is that, especially in women, this is mostly my female patients, that will start exhibiting oftentimes like reproductive wellness issues like chronic yeast infections or UTIs or new fibroids or something, irregular periods, hormones getting funky. Oftentimes infections are a big thing, like recurrent non-treatable infections. And I start digging into these people's cases, and it's like most of them have tried a lot of things along the way. Like they're not coming to me like people are educated. They're looking for things, right? And I'm like, man, okay, like yeah, you've tried a lot, and why hasn't it worked? And then I always ask this question. I always say, okay, well, what happened around the time that this started? Like did you move to a new place? Was there a change in your relationship? Was there, like what happened around there that could have like really rocked your world, whether you think it did or not? And almost every time that I have a female patient with one of these like kind of chronic intractable reproductive wellness issues, there's something about their intimate partner relationship that feels unsafe or insecure. Almost always, whether it's on their side or the other person's side. But there's something going on there, which is so interesting because it's their intimate partner, which pulls into play their intimate reproductive organs. And I think for women, spiritually, the reproductive system is like really the seat of femininity, right? It's like such the defining core aspect of female identity, or I would just say even just identity, right? Um, and I'm not just saying like XXXY. I'm like female identity.
Hmm.
And I think that it's no wonder that those systems in the body start to talk, because they're saying there's something wrong here. We don't feel safe, we don't feel secure, something's not right. Um and I've seen that so many times. I think maybe that'll speak to some of the people that are listening to this. But I also think like, a much more common thing that probably a lot of people can relate to is where people are always like, my gut feeling is that, something is wrong or something. And I'm like, yeah, your gut feeling. And it's all those people whose guts are a mess, like they have like chronic GI issues all the time. And it's like, yeah. It is really interesting because people actually speak the words that like make those connections really strong. It's like when people come in and talk about weight loss, and I have a very, very specific perspective on weight loss and how I handle that in my practice. But, people will come in wanting to have weight loss. And when we start talking about their lives and their emotional well state and like, we start digging into it, almost always they'll be like, I just feel like there's this weight on me. And they're saying that emotionally and spiritually. And I'm like, well, how long has that been there? And when did your actual physical weight become a concern for you? Like too light, or I mean, or if they're trying to gain weight, right? Either way. And there's just inevitably this connection between those things. And people don't realize it, but we speak our intuitive spiritual truths all the time in just these little turns of phrase that we use of like, oh, I just feel the weight on me, or I'm just run down, or I've been, like, and it speaks so clearly to what's happening on a physical level. And I see it all the time. So like I would say that's what I see clinically, but there's also just so much more data to connect the spheres. It's like I always tell patients, like 95% of our body's serotonin, which is one of our primary anti-anxiety hormones, comes from the gut. So like it's no wonder that people who have gut issues also have mental health issues or anxiety issues, and like vice versa. It's all over the place. And I think like spirituality too, God, can mean so many different things. And I don't know that has to mean like religion. I think it's just our connection to something deeper or bigger. And I think there's such a loss of that today for so many people, where people just feel so overwhelmed and disconnected and challenged and just weary.
Yeah.
That helping, I think that's why a lot of people's health is honestly off. That's why people are like, I just don't feel like myself. I just feel off. Like they can't pinpoint it, but something just isn't locking in. And in our philosophy in naturopathic medicine, we talk about the foundations of health or the pillars of health. It's not just your physical health and your mental health and your spiritual health, but it's also your social health and your economic health. And it's like all of these things that really have to stand together to build up your health. And if one of those is cracking or crumbling, it's hard to balance out your health. And so those are a lot of the conversations we have with people. That's why we take counseling training. We're not therapists, but I think it's important to be able to help people understand, like, where is that, which pillar is crumbling? Like, where is your joy? Where is your pleasure? Where is your spiritual connection? Where is your purpose? And it's so sad that a lot of people don't know how to answer that question. And so I think a big part of our work is trying to help people find that, or help them brainstorm ways to try to find that again. And oftentimes it starts in like the smallest things. Like, can you take 5 minutes to have a warm beverage on your porch and just stare at the clouds? And most people would say they can't make time for that. we can,
Fortunately.
yeah.
Yeah. Yeah, you hit on a lot of things, because yet people do say, and I've read that your gut is your second brain, so that tracks. And I feel that with just given the state of the world and so forth, if people would understand that when it comes to wellness and health, it's not just going to a doctor and taking this pill. Your wellness is all encompassing, exactly the things that you just touched on. And I feel that once people accept that, or maybe there's some way for, maybe there's some tool out there, or something just to help people realize just the importance of the environment and with whom they interact, or what they read and so forth has an impact on their well-being. There would be so many more healthy people out here. But here we are, doing the
We're doing
best
our
we
best.
can.
We're doing our best. We're bringing people back.
Yes, come on now. So I would actually like to just take a little pivot here, because you have spent so many years serving on the board of the Colorado Association of Naturopathic Doctors, and yeah, the president. Woohoo! You get that? Yes, and you've also taught, and with that, yes, a lot of pressure, a lot of responsibility, and so forth does come with that. And also in the same breath, you've stepped back from some of those responsibilities recently, and that was actually intentionally. And so, if you could and would tell us what shifted for you and what does leadership in that in this field, the medical field and so forth, what does that mean to you now?
That's a heavy question.
Yeah, I
You
understand.
know, I am definitely the type of person who has always kind of been, I mean, certainly the overachiever, but also always kind of felt like I had something to prove, which is like, you know, why I did school in 4 years. Like I probably would have done it in 3 if it was available. Like I'm just that person.
Got you.
And so, it followed that, when I started practicing, I wanted to immediately open my own practice. I didn't want to work under anybody else. And so I figured out how to do that. I started a business, and then I wanted to like grow my business, and I wanted to teach. And part of me teaching actually was just because I needed a job and a way to make money while I was waiting for my degree or for my board to come through. But I stayed teaching for a number of years. And I wanted to be on the board, and like I was kind of like the wanted to be involved in everything, wanted to do everything, wanted to have the experience. Um, wanted to have multiple practices. I like that. I was just on a trajectory of growth and what's the next step all forever.
Yeah,
And I think I thrived under that kind of stress, and just go, go, go for a very long time. And I think there were a number of things that kind of culminated into me deciding to take a step back. I stopped teaching actually right around the time that COVID happened. Um, and it wasn't because of that. I already knew that it was going to be my last term. And it was partially just because my practice was busy enough that like I didn't need to do both. It was taking away my attention to do both. But part of it also was that, and I'm going to try not to get on a huge soapbox here, but I did love teaching, and I taught what I do. I taught herbal medicine, and I taught, a lot about, I taught in the program I actually went to for my undergrad. So it was like very special for me to come back and teach in that program alongside the person who got me on this path. I was very passionate about that program and the work we did. But I also feel like, the educational system these days is in a place that, doesn't, I don't think it serves students in the best way it should, because, unfortunately, a lot of students are passed into like their next levels when they really shouldn't be. And I think there's a lot of reasons for that. I think it's hugely political. I think it's hugely related to, you know, schools are incentivized to have higher pass rates for programs. And I think, unfortunately, it has created generations of students who, they're just kind of like sitting back and doing the college thing because it's what they're told to do. And it's not because they're necessarily passionate about it, and that they're not really, exhibiting like a desire or a level of integrity that I think the professions deserve. And, my experience was I was, I mean, I was pretty hard on that line. Like I had high expectations for my students because in my mind, these were people who were potentially going to be my colleagues someday. And I wanted to know that I was going to be proud to say that I was one of their teachers, and that I was going to feel comfortable sending patients to them. And so I had high standards, not unreasonable, but high standards. And I kind of found that I was very shocked in teaching to find that there was maybe 5% of students who were like who I was as a student. There was 5% who were really like invested and interested and there to like make an impression. And everybody else was just kind of skating by. And if I graded them fairly and they didn't pass, it was always the same story. It was like, well, I need you to give me a passing grade so I can get into my nursing program, or I need you to give me a grade so I can get into my social health program. And I'm kind of like, I don't know, I want you to be a nurse if you like can't do the work. Like patients deserve somebody who's going to do the work, right? Um, or it would always be like, oh, they hadn't done their work up to that point, but then they wanted me to create, like, they wanted me to do more work to help them pass. And I was just like, that's not how the world works. But anytime I would say no, I would end up getting in trouble, and it was like, well, the students had a hard time, or, it's been a hard year. And I'm just like, there was a part of me that was kind of like, man, I can't be a part of something that is not maintaining a good standard of integrity for the future of healthcare. Like, I just cannot do it. And I spent a long time hand-holding these students and kind of dealing with the bureaucracy of the academic world that I just didn't think was serving patients. It wasn't serving students. It wasn't, I just couldn't do it. So I decided to take a step back from that. And then, but that opened up more time for my business. So I just like kept rolling with my business, right? And I opened up a second clinic. And I actually purchased a second clinic from somebody else. And within a year of that is kind of when everything changed. So, without going into all of the details of that purchase was an unfortunate mistake as a business owner. And there was a lot about that practice financially that was not clearly disclosed to me before it was handed over. And despite all of our best efforts to keep that practice afloat, there was a lot of problems that happened. And it became something that, being somebody who doesn't do well with failure, and trying so hard to keep it alive but make it better, and just the backlash that I would get from everybody for not being the original person who started that place, just became so, I mean, if I can, I went to medical school and it was nothing compared to how stressful this year was that I was in that. Like, there were literally days where I was like, I can feel years of my life going away, and I'm going to end up having a heart attack, or like, I just knew it. And I was also pregnant during that time, and just seeing how that shaped my pregnancy and my labor and all of that stuff. And it just became like all the stuff that I know and that I teach people in my practice suddenly just became so real for me in my life. And, and so we ended up closing that practice, which was, unfortunate, but probably the best decision I could have made for my family and for my health. And at the same time, I was the president of the board, and it just kind of, I don't know, it's just this whole new thing came to light for me. And it was like, man, I talked to all of my patients about finding joy and space in their life and happiness and trying to reduce stress. And here I am just like amping up my cortisol levels on the daily. And I think, once I had my son, I also just kind of was like, my perspective shifted, as it often does for people. But I think I just realized, life is too short. And I know, I have the benefit and burden of knowing what that does to you, that level of stress. And I just realized it was time to simplify and start taking things off my plate and not putting myself as the like sole responsibility for all of these different things, when there were so many other people who could carry on the organization. Um and so that's really where it came, is I realized that for a long time, I had this drive and this passion to just grow this empire of naturopathic medicine. And then I realized that I got to a place that in doing that, I was no longer able I didn't have the capacity to give my patients what I got into this practice to do. And I couldn't give myself or my family what I talk about all the time. And so it was a real identity shift. It was a real letting go and grieving of this person that I was, and the business trajectory I thought I had in mind, and really having like a hard shift into realizing a different path was probably going to be better for me and my family and for my well-being and for my longevity and for my patience. I can show up a lot differently now that I have some room to breathe. And so it's been really interesting as a path for myself, but also, so enlightening, even more so as to like what so many of my patients go through, and like how important it is to try to break from, the rat race of our culture. And I say this a lot to people that like, anybody who's online these days, it's like all about like the hustle and the grind and and like that is American culture. And I don't think it's all about the hustle and grind anymore. And I think that's a real disservice to the people living in this culture, that that is what we have been raised to believe success looks like. Um, yeah, I think a little bit of hustle is good, but like I don't think that has to be your whole life. So yeah, so it's been a big shift. I've made things quieter, more simplified, and I'm still working to that end. But I think it's so much truer to what I practice and believe.
I love that. And I am especially glad that you touched on that as a doctor when it comes to this grind culture, because I too resonated with that. And, for unfortunately for me, it got to a case where I got really, really sick before I realized that I needed to slow down. So thank you so much for sharing that.
I think
I
that's often people's
huh,
story.
yeah,
I think that
you're
is often what happens, is like it takes a wake up call, and
mhm,
that's unfortunate.
yeah.
Um, yeah.
Yeah, yeah. And so, just to speak on that too, if you could tell our audience one thing either about naturopathic medicine or about patient health or about what you've learned just in your 10 plus years of practice, what would it be?
There was like five things that just rattled through my brain all at once. I guess I would probably say at the core of it is that like every person has within them the ability to heal.
I love that. And if you want to mention those other four things, that's fine too. I know it's one, but four is
I think
absolutely
that's
fine.
like the baseline. Is like everybody has like their little built-in physician working on them all the time, and like sometimes we just need to get out of the way, and sometimes we need to help that little internal physician do it. But like we all have the capacity to heal. We have, that there's the healing power of nature and the world around us if we can just see that. Um but I think the other things that kind of went through my head were along the lines of like, you have choice. You do have choice, even if you're told that you don't, and that it's really important to self advocate and ask questions. And, I think so often people go to the doctor, and even like, a lot, like I run labs for people, but if they want to try to run them through an insurance provider, I'll like give them a list and then go talk to them. And almost never will their provider run all of the labs that I recommend. And I'm always just kind of like, and it's because their hands are tied by insurance, and it's a whole thing. So I do get it, and I am compassionate to that. But I think a lot of times, what I hear from my patients is their other provider will be like, I just don't see a reason to run that, or I'm not going to run that. And I always tell them, I'm like, but it is your health. It is your health. It's not the doctor's health. It is your health. And so I just want to encourage people to really advocate for themselves and say, well, but I want this run,
Mm,
period. It's not about what you want run, it's what I want run because it's my health and I want to know what this says. And I want to know what all of my options are, not just the one option you're placing in front of me. And I want to know what the pros and the cons are of all of my options. I want to know what could happen, good or bad. And I want to know what you're going to do about it when one of those things happens. And I want to know, like, I think people just don't take the time to answer those questions for people, but I think people also don't know to ask them. And it's like, you should always ask those questions like, great, what are my other options? What if I do nothing? You know,
Mm.
what if I choose one of these? What if I don't? And I think it's just important to self-advocate and start asking those like critical thinking questions. Because nobody else is going to tell them. And so unless people start really thinking and like being their own advocate and their own best friend, it's going to be really hard to get the types of questions answered or get the types of resources that they're looking for. I think that's what I would say is don't stop asking questions.
Cosign. Absolutely. Absolutely. And I have this guy that actually has 5 questions that I think that patients should ask their doctors. So yes, I agree wholeheartedly. And then as we get ready to wrap up, Dr. K, for our listeners who are interested in working with you, how can they reach you?
Best way to reach me is probably through our clinic website, which is the Denver Naturopathic Clinic. So you can find us online, you can call us, you can shoot us an email at front desk at denvernaturopathic.com. It's like naturopathic.com. And we would be happy to assist. We offer a free 15-minute discovery call to any person who's curious about being a patient, just to see if it feels like the right fit before you have to commit. But yeah, we'd be happy to meet you.
Beautiful. And Dr. K, thank you so much for sharing your work and your perspective and your experiences with us. And what strikes me about you is that you're not just a naturopathic doctor, you're someone who cares deeply about the patient outcomes, patient understanding, and patient empowerment. And you understand that true healing requires addressing the entire body, the body, the mind, and the spirit. And you're committed to helping us patients understand their health and take ownership of their wellness. And lastly, you are so deeply committed to the integrity and the quality of naturopathic medicine as a professional. And that's exactly what Let Care Speak is about. It's about healthcare professionals who care deeply about their patients and who are committed to clarity and understanding and who advocate for professional integrity and are willing to be honest about their own journey and values. And once again, Dr. K, thank you so much for being here. And to our listeners, always remember that better clarity leads to better understanding. Thank you.
Thank you so much.